What if I told you one of the biggest threats to your health after 60 isn't disease, it's too many medical tests?
That sounds wrong, doesn't it? We've been told, check everything, catch it early, stay ahead. But after more than 20 years in medicine, I've seen something most people never hear about. Sometimes doing more tests doesn't make you healthier. It quietly makes things worse. I'm Dr. William, and today I'll show you 4 common medical tests that often cause more harm than good, especially after age 60. Not to scare you, but to help you make smarter decisions. Before we dive in, you need to understand the cascade effect. You feel fine, so you get a routine test. The result shows something small, a spot, a shadow, a number slightly off. It might be harmless, it might have been there for decades. But once it's found, it can't be ignored. More tests, a specialist, maybe a biopsy or a procedure, each step adds stress, risk, and complications. And often you end up finding out it was nothing. That's the cascade. It often starts with a test you didn't actually need. First, full body scans, MRIs or CTs that promise to check everything at once. They sound smart and reassuring. In reality, these scans almost always find something in people over 60. Tiny lung nodules, kidney cysts, small liver spots. We call them incidental findings. Up to 90 to 95% of healthy older adults have them. Most are harmless, just aging on the inside. But once found, they lead to more scans, more consultations, maybe biopsies, anxiety rises, your risk of complications rises, and crucially, people who get these scans don't live longer or avoid disease more than those who don't. Instead, focus on function. Can you climb stairs, walk without getting winded, sleep well? Those tell you far more than any scan. Second, brain MR is for mild memory issues. Forgetting names or walking into a room and losing your train of thought is often normal aging. Many rush into brain imaging and get reports full of alarming terms. Atrophy, white matter changes, small vessel disease. These findings are incredibly common, seen in over 90% of people over 70. The problem is interpretation. You can end up thinking something is seriously wrong when your memory is functioning fine. Simple cognitive tests, recalling words, drawing a clock, are far more useful first steps, and if there is a problem, it's often reversible. Medications, vitamin deficiencies, poor sleep, or depression. Third, stress tests for the heart. If you're active, walking regularly, climbing stairs without symptoms, your daily life is already a stress test, yet many are sent to treadmills just because of age. Stress tests often produce false positives in older adults, leading to invasive procedures like cardiac catheterization with real risks. Frequently, nothing serious is found, and people leave believing they have heart disease, limiting their lives out of fear. A better option in many cases is a coronary calcium score, a quick, low-risk scan that measures real risk without triggering unnecessary procedures. Finally, colonoscopies after age 75. Earlier in life, colonoscopy is life-saving and prevents cancer, but after a certain age, the balance shifts. Risks like dehydration, sedation complications, and perforation increase, while the benefit, preventing a cancer that may take a decade to develop, decreases. For many older adults, that trade-off no longer makes sense. Instead, focus on symptoms, changes in bowel habits, blood and stool, unexplained weight loss, prioritize diet, especially fiber-rich foods. So, what's the pattern? One test leads to another until you're trapped in a cycle that may never have been necessary. After decades in medicine, I've learned this. Health isn't perfect test results. It's function, independence, and quality of life. Being able to move, think, and live without fear matters more than chasing incidental findings. Sometimes the healthiest decision is knowing when to say no. Be a smart patient. Ask, why do I need this test? What happens if it finds something? What are the risks? Is there another option? You are in charge of your health, not the system. Sometimes doing less is exactly what keeps you healthier.